Good evening, everybody. Thank you very much, and good evening for everybody that's online. We'd like to welcome you tonight to a Compass to MS Care program. This is Compass MS Care, Rural America, and Underserved Communities. To support tonight's program, we have Bristol-Myers Squibb, Genentech, Sandoz, and TG Therapeutics. Let's give them a round of applause, please. We couldn't do these programs without them. So I don't really want to take time from everybody else other than also thank our exhibitors. We had Alexion, Bristol-Myers Squibb, Genentech, Novartis, Sandoz, TG Therapeutics, and Viatris. I want to thank them all for being here as well. We have Rhea. Rhea is a clinical Pilates specialist. She's going to show you a little bit on some exercise that a lot of you never even heard about. Pilates. I thought you stand in a circle and you just go spinning all the time. But that's another one called spinning, right? So anyway, Rhea's going to, she came here also from Greenville, and we got to let her speak so she can hop on the road and take her 2-hour trip back. Bree, come on down. Let's welcome Bree.
Thank you. Hi, everyone. Has everyone here, or has anyone here heard of Pilates? Raise your hand. Yeah? Oh, nice. Has anyone done the Movement Monday series that we offer on MS Views and News? Yeah, Jill. Yes, of course. So if you're not already aware of it, I'm just going to put a little plug in there. I'll mention it as well during other parts of the presentation. But we offer a free resource for you guys to join in on Monday. So the next one is next Monday. We do it at 4 Eastern Standard Time. And you log on, go through the MS Views and News organization website, log into the class, and all we do is move. So we're going to be going through some of the movements. If you want to scooch away from your table, kind of just get the body moving. Then we'll get into what Pilates is. So I'm just going to go over some basic movements first. So everyone is already in your chair. I'm just going to take a seat here, get comfortable. Am I good? Got my best side? Okay, cool. All right, so the spine is meant to move in 4 different directions. Okay, so we've got flexion with your hands onto your legs. Go ahead and nod your chin down towards your chest as you hear my voice get deeper into the mic. It's like you're rolling down your spine away from the wall behind you. And then you can lift and stack your spine up tall. Okay, so that's flexion. Let's do that just one more time. Rolling your spine down like you've got a hood on and somebody's pulling your hood over your head. And then lift yourself back up again. Okay, so that's one part of the movement. Extension is where you lift your heart up and you bring your gaze towards the ceiling. Now, always be mindful of your body. So as you're lifting up and then looking forward, let's try to move with the breath. So try inhaling, lifting up, and then exhale, looking forward, releasing forward. Okay, so then you'll take your left hand to your right leg, and your right hand, you can hook it onto your chair. If you want to go the opposite direction, you can do that too. This is rotation. So lift your spine up tall and rotate in one direction as you try to look out over your back shoulder. And then rotate in the other direction. Opposite hand to opposite knee. Lift your spine up tall like a barbershop pull. So it lifts and twists. Okay, and then left hand stays down onto your chair, reach the right arm up towards the ceiling, and then take a side bend over to one side. Yeah, good job. And then over to the other side. So these are just some examples of movements that we do during the classes. We get into a lot more nitty gritty, so we'll be flexing as we lift one leg up, alternating. We can rotate towards one leg as you flex into it. So we kind of meld these movements together as we go through the class. And it's an hour long that we offer on Mondays, once a month, every month. So we also record the classes as well. So they're up on YouTube if you're ever interested in what is it actually that they're doing. All right, so my name's Bree Ray. Most people say Rhea, but it's pronounced Ray. So I'm a Pilates instructor, movement educator, and specialist. I work with clients one-on-one. I teach group classes. I have my own business. It's called Movement Studio. It's not spelled wrong. That's actually how I meant for it to be. So it's just a matter of what brings meaning to your movement. Okay. So what is it that gets you up out of bed every morning? What is it that your goal is when it comes to moving, whether it's through your day, whether it's from one room to the next? How can you move more efficiently, more effectively through your day? And then that studio at the bottom is where I teach as well, like part-time. It's a studio in Greenville on 1501 East North Street. So if you're ever in the Greenville area, we do offer privates as well. And we have very knowledgeable staff. So if you want to take a picture of that or maybe write down some of that information, you can always reach out to me personally or to the studio for a private. Okay, so when we talk about Pilates, we're not just talking about a system of movements, we're talking about a person. So this is Joe Pilates, and on the left-hand side, that's him at 57. He was born in 1883, and he died in 1967 at the age of 83, the ripe old age of 83. So Pilates at 57 on the left looks pretty darn good, like compared to the Pilates on the right. They both look great, but he was a man of his word and he walked the talk. He did Pilates every day. He moved his body every day. A lot of his movement centered around breath work. So this is an example of some of the mat movements. This is a move called teaser. And it started off initially as a mat sequence. So on the ground, nothing but you, yourself, and you moving your body around. Okay. So when it comes to the evolution of Pilates, this is one of the very early contraptions of one of his equipment called the Cadillac. So a lot of the equipment is spring loaded. So you have to work against the compressive forces of something kind of smushing and pushing you down, and you have to lengthen your spine and find that postural awareness, as well as like just opening up the chest, being able to breathe properly. So all of these things he thought about when he invented these apparatuses. So this is another example of the Cadillac. So this is a movement called breathing. And it's where you breathe through the movement to come into and out of the movement. So it's not only the rhythm and control of the movement, but also the awareness and proprioception of your body in time and space. Okay? Not just the Cadillac or the reformer that most people know about or mats, but there's also a chair. So this is not the chair that we use on Movement Mondays, but this is, again, a spring-loaded contraption. It's kind of hard to see in the black and white. Let's see, where's the laser? Here. Oh, okay, now we're talking. So the chair that he's sitting on can also be laid on, can also be like sat on from the side, can also be laid on from the front. And you can kind of see here, that's where the springs are loaded up from the top, and this is the pedal that he's pressing down. So it takes a lot of core control to be able to move through these movements. But don't let these movements be intimidating to you, like especially if you're more like wheelchair bound or chair bound and you're unable to walk around. There are still movements that you can do to help open up and breathe better, move better, and even just think better. So when we talk about Pilates as a system, we're talking about a low impact system that strengthens and lengthens the muscles, the tissue, the entire body. It's movements that enhance our posture, our alignment, our core strength, and overall body control. And it's also motions that are centered around the breath, okay? So being able to breathe properly, as well as lifting yourself up in order to move your arm or your leg in one direction or the next. And with that comes a self-mastery of your movements and control of the mind and body together. And also, I'm a very firm believer in this, but like if everyone did Pilates, the world would be a better place. So it's a way of life. If you did Pilates, you know that like, okay, I might just be going up some stairs, but I'm not going to slump around and go up some stairs. Instead, I'm going to lift myself up so that it feels and looks and is more efficient movement for my body. So a way of life. So when we talk about Pilates and the benefits that we can get through MS, or if we have MS through Pilates, there's 6 main principles that he taught from and that we're gonna like kind of translate if we have MS. So when it comes to the 6 main principles, we have our breath, we have the center or the centering of your body. So think of like you had a string or a plumb line running all the way down from the top of your head down to the tip of your tailbone to your heels. So we want to find the center of your body. So I know a lot of people, myself included, I was just doing it, like kind of like pop the hip out or stand to the side, or they kind of like stand forward, they have that forward rolled shoulder posture. Instead, what is the centermost part of your body that you can connect up into and draw that energy up and in when you're seated? when you're standing, when you're walking, when you're moving. So the control of your body all kind of centers around the breath and the centering of your body, the concentration that it takes to be able to do all these things, and the precision of being able to be like, okay, my right pinky toe is going to be moving and my left index finger is going to be pointing. So being able to control that precision of the movements. And then finally, creating all of that and putting it together like a dance, a flow. Okay, so if we have multiple sclerosis, why would the breath be important? You have more energy, okay? The body, the brain, all need oxygen. We need air, oxygen, nutrients. And so when we breathe in, in yoga we call it prana, the life force energy of air, then you have more energy to think clearly, more energy to move, and also that means the ability to relax. Okay, so with our centering, we're talking about our posture. Every time I say posture, everyone starts to sit up a little taller. I love that. When we talk about control, that means that you have more energy throughout your day. You have the ability to not feel tired at that lunchtime slump, but then you have that energy to continue your daily activities and things that you want to do and that you love to do, instead of having to hold off and be like, oh, well, I just don't have enough energy for that. The neuroplasticity of concentration, and I love that this kind of complements what Dr. Hughes was talking about, is the ability for your body to build new neural pathways is so important, especially when it comes to movement. So when people say, like myself, who say movement is medicine, your brain was meant to think, your lungs were meant to breathe, but your whole entire body was meant to move. So let's not take that away from ourselves. When it comes to precision, we have the accuracy of the movement. So being able to say okay, I'm gonna stick my left hand right out in front of me to shake that person's head. Technically it would be your right hand, but the precision of the movement instead of reaching off over here for the hand. So the ability to be precise in the movement. And then finally, the flow of things, being able to mobilize, to be flexible, to have the strength to move and kind of coordinate those movements all together with each other. Oh man, that box was supposed to go in last. All right, so imagine from your rib cage to your hips, you have a box, and then that box is also on the outside of your obliques, as well as on the front and the back side of your body, okay? Kind of like a Coke can. So if you had a Coke can, right in front of you, and it's filled up with soda, or whatever it is that, I don't drink soda, but you're trying to stomp on it, okay? So try to stomp on it, it's not gonna crumple. But if you poured out all the contents and you tried to step on it, it would crumple immediately. Does everyone understand this analogy? Okay, so if it's full, yes, it doesn't crumple. Think of that as your abs. Your deep core is what we're talking about here. So these four muscles, you see where's my laser? The diaphragm, the multifidus, the transverse abdominis, and the muscles of the pelvic floor. All of these are muscles that are at the centermost part of our body. Okay, you don't have to there's not going to be a quiz about this, but these, if we think about what they do, the diaphragm helps us to breathe. So when you take a deep breath in and take a deep breath out, you're going to use your core. So let's all do that right now. So sit up nice and tall, take a big breath in, and notice how much air you can take in when you are sitting tall. And as you breathe out, keep going, keep going, keep going. I know, keep going, keep going, keep going. And notice, do you feel your core working when you breathe out that firm exhale out? So that is an example of your diaphragm working with your transverse abdominis, which is like a corset or a belt that wraps around your waistline. Okay, the muscles of the pelvic floor, this one's a little fun to talk about. I used to work in a physical therapy office as their clinical Pilates instructor. So for women postpartum, rehabbing their pelvic floor was all that we did. So Pilates really complemented this because of the deep core. So with the muscles of the pelvic floor, I want you to think of where you're sitting, feel your seat on your chair, and imagine you are pulling something off of your chair up inside of you. That's how the muscle works. I know, it makes everyone giggle, it makes everyone laugh, but just like how your bicep curls your arm, the muscles of the pelvic floor are kind of like maybe a jellyfish moving upwards through the water. The pelvic floor lifts up inside of you, okay? and I don't mean to be vulgar or anything, but I think we're all done eating, but like imagine you're trying not to like pass any gas right now. So like lift up and in. Those are your muscles of the pelvic floor. So when was the last time you actually used them when you weren't trying to like pass gas, okay? So think of that when you're working the deep core. And then finally, we have our multifidus muscles. These are tiny, tiny little muscles that you see kind of crawling all the way up the spine. They don't just end here. But with these muscles, they help us to lift up into that extension. So you can either like pull all the way back or you can lift all the way straight up, okay? When you curl forward, you stretch those muscles. All right, so think of again that soda can. If you tried to smush and push your spine after you've gotten all those muscles turned on, you're not budging, you're not going anywhere. The connection between the upper and the lower part of your body is the core. So if your core is online, then everything else will start to come from that. Upper and lower extremities, thank you. So with the deep core, there's this theory called starfish theory. When you think of a starfish, you don't see it like moving its little tentacles off to the side, or I know it's not a tentacle, but like imagine they had little fingertips, okay? Instead, how it moves is it moves from the center to be able to move the arms or the legs or like the top part of the starfish. So anytime that you're moving, think of moving from the core. Okay, so that's our pelvic floor, transverse abdominis or TA, multifidus, and your diaphragm, that box. So here's your pelvic floor muscles, and we're gonna go over this just real quick so you can see like and get a visual for what the pelvic floor muscles look like. Okay, so this is a female pelvis. Here is where the urethra goes through, and then this is a male pelvis. Female would have 3 holes. Okay. Urethra, vagina, and rectum. So males, this is you guys, urethra, the pee hole, okay, and the rectum or the poop hole. Totally scientific here. Then you have your transverse abdominis, okay, that is that corset. It looks just like a corset. So like for like people who've done like waist trainers before or like held like wrapped a belt around your waistline, like there's a muscle that does it for you. So think of like drawing like the ribs together, your navel towards your spine, and pulling up and sitting or standing taller. That's your transverse abdominis. The multifidi muscles, all those little tiny like tracks that go up your spine. And then finally the diaphragm. It kind of like is a reverse balloon. So it like when you inhale, that muscle pulls down into your abdominal cavity. Okay. All right, so the centering concept of your body is that soda can analogy. All right, so with Pilates, it's mindful movement. Of course it's going to help. Are you mindful when you're getting up out of bed in the morning? Are you mindful when you're, not going to stub your toe on something? Are you mindful when you're getting up into the car or out of the car? How can things help with you? So this is where we're going to take a seat again, or I'm going to take a seat again onto the chair, and let's go through some more of that flexion extension that we worked through at the beginning of our little presentation. So scoot yourself away from your table again. This time when you go into that flexion, I want you to reach your arms down for the ground and really draw your abs up and in. So think of that transverse abdominis, that core setting of your abs drawing up and in. But now when you come up, can you lift one leg with you? So you might grab it with one hand or pull it up towards you. And then put that leg down, flex forward, grab the other leg and pull it up towards you. Yeah. Okay, so now can you grab both legs? I'm just kidding. Don't grab both legs. Just seeing if you guys are paying attention. All right, then our extension. So remember, this is where you lift your heart up, lift your gaze up, and then exhale to come forward. So now can we lift the arms? And so we're bringing different parts of your body into the movements, and then exhale the arms down, look forward. You can give yourself a little extension with rotation, one arm reaching back, sort of like a backstroke, and then try that on the other side. Lift up, and this helps to open up the chest, open up the rib cage, open up the airways. Okay, next we either have flexion or, there you go, lateral flexion. So from side to side, one arm down, one arm up. Ooh, and then my spine just got a little adjustment there. So you might notice, like, as you're moving, if you haven't moved in a minute, like I know it's been a minute. So like you might start to feel some like little creaks and cracks through your body. So now with your lateral flexion, add rotation. Bring opposite hand down to the opposite thigh. Oh, there's another spine adjustment. Bring it over to the other side. So your lateral flexion and then rotation. All right, and then finally we have our rotation. So now think like a sprinkler, just rotate your body from side to side with control. So you're not just flailing your arms around, but with control rotating to the right, with control rotating to the left. Yeah, either way, right to left, left to right. Okay, awesome. All right, so everyone's always like, well, what's the proof? Where is the research? How do we know that it actually works? Pilates is over 100 years old, but there's also these two really great research articles that were done. So this was a randomized control trial that tested the feasibility of online mindfulness. So hint, hint, our Mindful Mondays that are offered not just Pilates, but also yoga. These are options, and I think we also have physical therapy. Is that right, Stuart?
Yes, we do physical therapy once a month.
Once a month. Okay, so physical therapy once a month, Pilates once a month, yoga once a month. These are mindful movements that are offered online. So this is a great example of how this helps. Okay, so what they found was in an 8-week study, they compared chair yoga, mindful movement, along with daily journals that these people kept throughout the study with a pre and post questionnaire. What they found was that online delivery of mindfulness may be feasible for people with MS. Now, I know that "may" word kind of sticks out, but that's okay. Like, if it's gonna work, like, why not try it? It's not gonna hurt. So keeping that mindfulness journey, understanding or connecting with your body on a daily basis is not going to hurt you. It's going to help you connect and create those neuroplastic pathways. Okay. The next up, we've got our mindfulness in motion for people with multiple sclerosis. This was where they did another 8-week study, so 2 months. 2 months was all it took. Once a week for 1 hour, and this wasn't even for a full hour of movement. For 1 week, basically 20 minutes of mindful movement. So they talked for 40 minutes of like, here's what we're gonna do, this is how we're gonna do it, this is what you're gonna feel. All of these things were done, and then 20 minutes of the actual movement was done. So 20 minutes for 1 week, and they found that the resiliency skills of mindfulness training may be beneficial in helping to mitigate unpleasant, unpredictable mental and physical symptoms that are associated with an MS diagnosis. So when we have this like sort of mindset of just like, I have MS, it starts to become a little bit of your identity. Like the psychosomatic the play that starts to go back and forth. So thinking of how moving and just 20 minutes a week helped these people, comparing the pre and post questionnaire of their physical and their mental symptoms of MS. If that's all it takes, like, why not do it every day? You can like compound that feeling even more. So if you haven't already noticed, like I have a favorite word, and that is called noticed. So the word of notice. So I want everyone to just close your eyes. And what do you notice outside of the body? You might hear things in the other room. You might hear my voice. You might even see the light, even with your eyes closed, that's in the room, that's illuminating the room. You might notice some smells. Okay, you might notice the clothes that are on your body. So all of this is just outside of the body still. But now I want you to notice what is within the body. Do you notice your heart beating? Your lungs breathing, your chest and your belly rising and falling? Do you notice how as you breathe in, the air is a little cooler than when the air is breathed out? So when it comes to the breath, what do you notice? Is it fast? Is it slow? Does it go all the way down into the belly? Think of drawing it down all the way into the pelvic floor. Deep down. And then as you exhale it up and away, try to like almost like a tube of toothpaste, squeeze that air out of you. Breathe it out. What do you notice about the mind in this moment? Maybe just noticing these individualistic things, the mind has started to slow down its chatter. Or maybe you notice things a little more clearer than you did before. The noise from the other room, maybe you're like, gosh, I wish they'd be quiet. Don't they know we're learning about MS in here? Pilates. So just notice, like, what's going on? Is the body tense? And is it soft? Where is it tense? Can you soften into it? Is the body a little too soft when it comes to posture? Okay, so can you sit up tall, but can you soften your shoulders down? Can you sit up taller, but can you soften your jaw, your face, your eyes? All of these things to notice. So then you can open your eyes. Notice everything else that is around you now that your eyes are open. So 40% of the information that is coming to your brain comes when your eyes are open. So when you close down your eyes, you can tune in a little bit deeper to your inner self. So yeah, that's my name, that's my information. If you guys want to take a picture of that or reach out, I'm ready for questions. So ready when you are.
Let's thank Bree.
Thanks so much, you guys.
Does anybody have a question for Bree?
Can you tell us the difference between Pilates and yoga?
Good question. A lot of people get that kind of mixed up. And the reason why is because Pilates does look very similar to yoga. There's a lot of inspiration of yoga when he was first creating Pilates. But when you look at or when you start to practice Pilates, you'll see a lot of other different themes as well. There's animals, so like there's a move called elephant, another move called stork, another move called dolphin. So of these animals, like Joseph Pilates was really keen on looking at nature and looking at how the body moves naturally. So you can also see the similarities with yoga, how the body moves and kind of rolls through certain movements. It is very different because it's more rep-based in Pilates. So we might do 8 to 10 reps of something versus yoga, you're gonna do 8 to 10 sun salutations, which could be like 5 to 8 different moves in one. And then you'll start again from the top, do those 5 to 8 moves again. So Pilates is very rep-based and set-based. That's the biggest difference. And Pilates also uses apparatuses or apparati, whatever the plural is of apparatus. Thank you, apparatus.
Okay, question here.
The exercise you just had us do, could that also be part of meditation?
Yeah. Mindful movement, totally. There's movement meditation where people will, just be mindful of how one foot is stepping onto the ground, one foot is stepping in front of it, how the pebbles or the rocks or the concrete might feel under the legs. Totally. Yeah, great question.
Also, along with what you said about meditation, couldn't that be if you're going through a stressful situation is to do that as well?
Oh yeah. I mean, exercise, the benefits of exercise, it'll lower your blood pressure, it'll help with your heart rate variability, which is like your body's correlation with stress. So tons and tons of benefits of exercise when it comes to stress or mitigating stress. Yeah, great question.
I have a question for you. How many times a day, or what's the best time of day to do Pilates?
I say the best time of the day to do Pilates is the time that you can stay consistent with it. So if you're a morning person, do it in the morning. If you're a nighttime person, do it at night. If you know that you have more energy at certain times of the day, do it during that time of the day. But you could do Pilates every day. I recommend starting off with like 20 to 30 minutes and working your way up to an hour. If you're coming to our MS Views and News Movement Mondays, it is a full hour. So it's great because you're at home. You can take breaks as you need, listen to your body as you need. Don't use the props if you need. All of these things of listening and being aware of your own body is going to take precedent over the things that we do for an hour-long class.
Great, thank you for that. And did you say that the time starts at 4 o'clock?
Yes. We're done. Thank you. Thanks, everyone.
Thank you again for coming tonight, and drive home safely. Bye-bye.